Well, good afternoon. It is 11:59. We're a minute early, better than a minute late. So, good afternoon. John Perez here. Welcome to Beyond the Devastation, episode 3. Today, our guest is Robert Ferrer. He was our guest for episode 1, and I went I went by myself solo episode 2, but bringing him back for episode 3 because we want to talk about Beyond the Devastation. His story is certainly unique to him and what transpired, how things really unraveled, but yet how things came back together. And more importantly, what we're seeing now is on the other side of the devastation. And I'm going to let him talk about himself because it's easier. And we're going to have some really candid conversations. You might want to cry, you might want to laugh, but either way, I hope that it touches your heart because this is Beyond the Devastation. And joining me now is the guest that was here for episode 1. He made history.
Right.
He made history. He was a little under the weather for last week, but I'm just grateful that he's better. He's got a lot of kids to take care of. He can't afford to be sick. But Robert, catch us up. I mean, kind of where we left off in episode 1 was you had just come through the traumatic event of the loss of your infant son. And I wanted to leave it there because we knew we were coming back. But let's catch everybody up. I guess for those that weren't on, Robert was devastated with the loss of a son who had gone through a long illness. And Robert, I guess, walk everybody through, how did you handle it? Because I thought you were really honest with everybody, how you really dealt with it. And then let's go into where we are today.
Well, I'm glad you asked that. I mean, devastation is such a powerful word, and that's what would describe my feelings, is feeling devastated about the whole situation. When my son being born with this illness, it was a very rare disease, something we've never heard of before, and we didn't have any issues in the past. So it was kind of like a shock on one hand, but on the other hand, you get hit with shock and devastation at the same time. So then going through that process, you kind of like in adrenaline mode. You know, you got to do what you got to do. You're not really thinking about it as much, but you got to kind of get through it. And then when my son passed away, transition, it just all hits you. And you're just like, wow, what just happened? You know, I can't believe this happened. You start questioning God. You start questioning your relationship with God. You start questioning yourself. Did I do something? You start blaming your spouse or something. You know, you just figure so many different emotions that you're dealing with. So that devastation hit us in so many different ways. And the problem was, and we talked about this last time, is that I didn't seek out counseling. I didn't seek out therapy. I didn't seek to be a part of support groups, something that will help me in those moments. Because we always have those moments. And I think it added to the devastation. You know what I mean? So now I'm having new emotional issues. I'm having new mental health issues that I didn't have before, during, or after the situation. So I was just hit with so much stuff, and you know, it affected me. And I tried to ignore it, but it was affecting me.
And I think that, so you make so this is what I'm hearing, is that I knew I had a problem, but I didn't go to the doctor.
Right.
And think about how that devastates our communities of the Black and brown, right?
Right.
We got a problem, but we don't go to the doctor.
That's right.
Why is colon cancer on the rise? Why is diabetes on the rise? Because we know we got a problem, but we don't go to the doctor.
Right.
And we've got doctors.
That's right.
It's not I don't trust them. Listen, so many people have lost the battle to cancer because they never checked it out in the first place.
That's right.
And they're devastated when they hear the words, you're at, what is it, 4? I can't think of.
Stage 4, yep.
You're at stage 4 colon cancer.
Right.
Stage 3 colon cancer. And you're like.
That's right.
And then the doctor says, the doctor's not going to say, hey, you haven't been here in 5 years.
Right.
But that devastation of hearing the news. I mean, here you were. And I remember, and if you guys don't remember, look, Robert has a very robust family.
Right.
How many girls again?
7 girls.
7 girls, right? You have an elder son, right? Son packed in 7 girls.
Right.
He got his wife that's 8 women in the house.
That's right. That's
Poor
right.
Robert is defenseless.
I'm done.
Right? He's done. It don't matter. If there is no football in the house, I understand why.
Right.
They're watching Barbies or whatever. But
Right.
what he went through,
Hmm.
and he didn't get help.
Right.
But tell us what that did for you, because you're now a mental health counselor.
Hmm.
But that led to you doing something great with your life, right?
Yeah, it really did.
What didn't happen here happened someplace else.
It's so powerful because God gave me an awakening. When He caught me in a moment of just complete despair, but at the same time, I was more open. And God dealt with me about learning more about counseling, learning more about mental health. So I went on a quest to learn more, and I actually went to school and was able to attain my degree in psychology and Christian counseling. And then I went on to get a degree in Christian ministry and pastoral counseling. But throughout that time, I was able to do internship, work in areas of human services, social services, substance abuse counseling. I did counseling almost in every area. Young people dealing with that are emotionally disturbed. I just started really giving myself to that, and I call it a ministry, to that ministry of mental health. And I learned so much in the process that I really missed out on. And I realized that it was calling on my life to work in this area of counseling and mental health. There was so many in the church that just needed someone to talk to. The therapy was just the conversation. That's all it was. And so I was like, wow, this is really healing. This is a ministry. This is somewhere God can bring healing to people. So when I go to different events, or like I said, I talked about training I did in psychological first aid, and we talked about compassion fatigue and things that people deal with that work in area of servitude that are necessary, and people don't really step out and do that. So I tell people, God is a strategist. He's always given us strategy on how to navigate this thing we call life, because life is complicated. Something can come on you tomorrow that you did not expect, that you were not prepared for, and you have to be able to deal with that mentally. So, preparing yourself now is going to help you in a tremendous way. And there's things you can do physically even to help you emotionally and mentally.
And I like what you said. Prepare yourself now. Look, we always try to tell everybody, look, you don't know when conflict is going to come up. You don't
Right.
know how conflict is going to come up.
Right.
But it's best to learn how to do conflict resolution when there is no conflict.
Right. That's
Right.
right.
So let's learn how to role play and handle conflict resolution.
Right.
But what you also said is that, look, what you didn't do for yourself, now you're doing for others.
Right.
Right. I didn't get help,
Mhm.
but God really said, hey, there are others that are in your boat that are doing the same thing. They're not having those hard conversations.
Right.
And
Right.
now I want to put you in a place where you can use your devastation
Uh-huh.
to turn somebody else's life around.
Right.
And that's a powerful thing when you go through the depths of a loss,
Right.
and then you can turn around and you can make good out of it.
That's right. That's right.
Think about Robert, think about COVID, and think about all these things that are out there
Mhm.
that people didn't even see their loved ones through just maybe the means of a Zoom call.
That's right.
And they saw them grab their last breath, and it was done.
Right.
We talked about it last time. No closure.
No closure.
And in the green room, we were talking about
Mhm.
how we really need, and this is where we talked about it when we need better tools
That's right.
for pastors to recognize that this is not the devil made me do it.
Right.
To
Right.
borrow a line from Flip Wilson for all those who are old enough to remember, and you can even put it in the chat if you're old enough to remember. But it really is a psychological concern.
It is. It is.
And what are, like, again, just to refresh everybody, because we're going to move to where we are beyond,
Mhm.
but give us like 3 or 4 things that as you see it, because as a pastor,
Mhm.
you're already trained.
Right.
But as you're saying that emotional or psychological first aid,
Mhm.
what's the first thing I pull out of the first aid box?
First thing is you got to deal with trauma. Most people are dealing with the effects of trauma. Trauma has a lasting effect on you. So if you've been traumatized in some way and you ignore the fact that you've been traumatized, you may not realize that that trauma has affected your mood, it has affected your personality, it affects your behavior, and you've been just dealing with trauma. There's nothing wrong with you per se, but you went through something traumatic and it affected you, and that's okay. We just got to deal with the trauma. When we start dealing with trauma, we'll start seeing the healing process begin. And a lot of things that we say and do and think will not even be an issue for us anymore because we started working on dealing with our trauma. And that's what I teach people about. I teach a lot about coping skills and learning how to deal with your trauma, not ignoring it, not acting like it doesn't exist, but really dealing with it. And then you start seeing healing happen. And a lot of times God will birth a ministry out of it. Like when people are dealing with their own trauma, God uses those same people to minister to other people who would never receive from anyone else unless they've been through trauma. You know what I mean?
And it's funny. Look, you can't think about your life, right? How can you tell somebody about grief if you've never experienced it?
Right.
How can I tell you about financial gains and losses if it's never happened?
That's right.
Right. So you and I were talking in the green room about, look, I'm 58 years old.
Uh-huh.
I didn't tell my age, but I am now. I'm 50. I'm going to be 50. I'm going to be 58 and I'm already living it. I'm going to be 58 in a couple months.
Okay.
But you and I were talking about this trauma, right? Unpacking the trauma, right? So I had gone on and told everybody, hey, I'm fine. My dad is fine. My dad came to my wedding in 2010. We're okie dokie.
Right.
That was the furthest thing from the truth, right? And I was sharing with Robert that, in 2019, I had a big breakthrough, right? This is where the birth of this Beyond the Devastation comes from, just so everybody can really understand where the impetus for this was.
Right.
So in 19, my wife and I said, I had some things that I needed to deal with. I went and got help. I'm not afraid to say it. I talked to a mental health specialist.
Good.
And again, I'm not afraid because, look, I want everybody to know as a leader, as a pastor, as somebody who teaches leadership, guess what? I needed help.
Right. Right. That's right.
And the mental health professional said, I'm going to ask you one word and then give me that word that you come up with that when I tell you what it is, just give me quickly.
Mm-hmm.
He said, Father. I said, hate.
Mm-hmm. Mm-hmm.
I scared myself. I was so scared. I was like, oh my God. I went home and found a scripture that said, how can you love me when you say you hate me? I said, oh man. I called my father so fast. I drove 4 hours to PA and I made it right.
Right.
But because I wanted to, right?
Right.
And I think that's part of dealing with the trauma, right? I unpacked it. The first thing that came out was I still had daddy issues that I hadn't dealt with.
Mm-hmm.
That was driving behavior. That was driving the ship.
That's right.
But to your point, I unpacked it, dealt with the trauma, went and dealt with the issue. And when I got there, my dad goes, I've been waiting for this day for a long time.
Right. Wow.
And then what he said to me, he said, then my dad began to pray that prayer that you would normally get for the eldest son, which I never got, right? Mm-hmm. And it completed so much in my life.
Right.
And it's like, it turned my ministry.
Wow.
And I'm like, I'm here doing this because there's so many other people like you and me that we've been devastated. My dad walked out on us in 1976, July. I remember that day like it was yesterday. It was drizzling outside. The woman that came and picked him up was driving a brown Datsun B210, this beat up old hoopty. And I'm 11 years old and I'm pounding on the window for my dad to come back in the car with us.
Wow.
And he looked straight ahead through the windshield and they drove off and I didn't see him again.
Wow. Wow.
I'm sitting there like a movie, right? Crying my eyes out. And I jump back in my mom's old Chevy Bel Air, 1960 something. Wow. And we drive an hour home and my life is devastated.
Wow.
So think about what we're trying to say, right?
Mm-hmm.
It took for recovery. That was 11. I didn't get it right until I was 55.
Wow. Mm-hmm.
That's a whole lot of time to hold on to a whole bunch of junk.
That's right. That's right.
And Robert, that's what we got going on in the church.
That's right.
And people are masking it. And you know what I found? If you listen to preachers long enough, you'll hear the pain.
Yeah. Yep. That's right. That's right.
And I can say now that I know.
That's right.
What's behind door number one? because
And I love that you're doing this, because I had talked to a pastor recently who lost their wife, unfortunately, and he was saying how there was no one to talk to because he didn't know anyone that had dealt with that per se personally, that he felt comfortable. And he said it felt like it was a different thing losing a spouse or a child. So he called me and he was saying that just being able to talk about how this affected him, even his relationship with God, it started to cause him to start to reevaluate and change his perspective, step into an area of healing, emotional healing, and wanting to recover, because he dealt with some issues that he didn't really think about until his wife passed away. You know what I mean? And he's like, wow, I didn't know this just really hit me in so many ways, and I didn't realize it. So trauma is very real.
So if we pull something out of the first aid kit, what Robert is trying to say is, where's the trauma?
Right.
I think it's sitting down with your member and saying, and being honest.
Right.
Hey, I've noticed a couple things.
Mm-hmm.
And ask them. And I think the other thing we have to unpack, Robert, is asking the right questions.
Right.
And you're trained, right? So look, here's what I do now. If I don't know, I'm calling Robert. I'm gonna say, I'm doing phone a friend.
Right.
And I'm saying, Robert, they're coming to you.
Right.
Because I don't know what to ask. I know how to ask for me because I know I can only do it based on what I've been through. So if I have somebody that's been through the same, I know the questions that I had to deal with.
Right.
But trauma comes, Robert, I'm assuming trauma comes in very many colors and many, many shades.
It does. It really does. Yep. And it's funny you say that, because I was talking about that the other day. I facilitate a grief ministry group. It's an outreach ministry for Little Rock Baptist Church under Pastor Craig Henry. And in that group, we talk about emotional intelligence. We talk about trauma. We talk about things that people normally wouldn't feel that comfortable with because they've been dealing with it all their life. And I learned something so cool is that we always have an awakening moment throughout our lives. Like we have these moments where just it's something sparks in our head and say, wow, I didn't even think about that. Where'd that come from? You know what I mean? And when we have those moments, we cannot let those moments pass or think it's an insignificant moment. And when doing that, I've learned this so powerful key is that people have more abandonment issues than you would think. Even from childhood, where they feel that they've been abandoned. In church, they feel abandoned. At home, they feel abandoned. Places where you would never think people feel abandoned. They never really express it, and it affects them.
So, wow. So we've got trauma in many forms and shapes.
Right.
It could be an abandonment. It could be, look, we've seen it all, right? Child's been molested at a young age.
Right.
Child's been abandoned. I was adopted. Nobody wanted me. I was spent all my life in foster care, and I aged out.
Uh-huh.
The loss of a child, a parent having to bury a child,
right,
regardless of age.
That's right.
To bury a child,
right.
Or I think you were kind of, you were alluding to this with the husband. But think about a child who never got it right with their mom or dad, and they died.
Right.
And they're gone.
That's right.
These are all devastating periods in our life.
Uh-huh.
The question is, how do you get beyond the devastation?
Right.
So Robert, you lost your son to a very disease that was very rare. How long did it take you to really recover and then to bring you to the place where you and your wife are today?
Well, I'm still recovering. I don't think I'll ever recover from the actual event, but I'll say that when those moments happen, I respond different than I would have in the past. And when I say respond different, I mean like emotionally and mentally. Like I couldn't hear the word with the name of the disease was called Pompeii. I couldn't hear the word Pompeii. Like, if I heard that word, it would do something to me when I heard the word. And I used to be like really affected by hearing it. So I learned over time how to respond to that feeling that I've had when I heard the word, or certain things that remind me of what happened. You know, I learned how, and I do counseling, so I'm always dealing with people that are dealing with trauma or loss or recovery, or so I could constantly be reminded. But I've learned now how to respond. So now I think that my recovery process has grown, and I'm constantly in recovery, but I got to be intentional. And I tell people this: you have to be intentional. You can never start feeling like you're skating and you're good, you're fine. You're never going to go. You got to always have your mind ready. Okay, how do I respond if I'm having a moment today? Or what if something reminds me and I start reverting back? How am I going to deal with that? You know what I mean? So I always teach people. And I think in the church, it's so important that we provide resources for people so that when they're feeling a certain way, they can have a place to go, or a person to talk to, or some place where they can receive some healing, you know, emotional, psychological, mental, and let God strategically bring them into a place, you know, of the recovery process. Because you don't want to not do it. You're gonna have a problem.
I'm playing back what you said because we don't have it in the church, but on the job, you've got that place where you can call as the employee helpline or whatever they call it. The employee, you know, it's EN, whatever what it is, but you can call and do a, you know, a confidential call to get help, right? We have it on the job, but we don't have it in the church.
Right.
And because let me be totally transparent. Because in the church, when you say something of a mental nature, you automatically get pigeonholed.
Right.
Because of that problem.
Right. That's right.
And it causes more trauma than the trauma they already had.
Right.
So they came to the safe haven, and we're the hospital, and then we just threw them in the psych, and we threw them in the psych ward.
Right. That's right.
When I was, and I can speak to it because when I was going through my problem, people came to my pastor and said, "Is Elder Perez okay? He looks a little off. Is he crazy?" Robert, I kid you not.
Wow.
They used the C word.
Wow. Wow.
And see, I found out after the fact, right? But this is what happens in the church. This is, I've been there. I was there from 1994 till present, right? And they were saying words like, "You're crazy."
Wow.
And I heard it, and I'm like, I just thank God I was in a better headspace to take it.
Right. Right.
But we need that emotional place that we can put up. We should put up. Unfortunately, nobody wants to do it, but I think I'm going to have to. We can put up a flyer in the church. Say, "Look, if you need help."
Right. Yeah.
We do it on the job, but why not in the place where they need the help the most?
That's right. That's right.
Because we don't want to take religion. We should say we don't want to. It should be relationship and mental health and put it together.
Right.
Because religion will stop you from doing stuff, but relationship will cover that situation.
Right. Right.
And it.
That's why I'm
attacking me up a wall.
It's funny. I'm attacking that stigma. Even in my own church, I make it a culture of, you know, it's okay. Therapy is good. Counseling is good. You know, things like that. We make it a culture where we can talk about it. It's not taboo. You know, it's something that's good. They know I'm involved in mental health, so it's not like something that's you don't want to touch on, and it makes people uncomfortable. We try to build a culture where we're comfortable with that topic. And I tell people all the time, like even recently, I was saying to someone, you know, if it's not us having an established outreach ministry for mental health, then we'll be connected to those groups that have it, so we could direct you to it. Like I said, I've been a part of New York Project Hope for a couple of years now, and it's a free service. People can go online at newyorkprojecthope.org and get information about coping skills. You can talk to somebody. It's anonymous, confidential, free. You know, when we get information about stuff like that, we put it up. We let people know about it, so that even if they want to just go on their own and they don't want to talk to anybody, just go ahead and just know that it's available and it's okay.
And I think that the more that they hear that from the head, the more it gets easy and it comes down, the
Right.
easier it is. So I put this up because I assume they're related to you. It's
Yeah,
I got
that's my oldest daughter.
I figured, hey, thank you, oldest daughter. This is a great question. She said, at what point does one need help in the healing process? So she asked the question, Dad,
Uh-huh.
what's the answer?
I think we always need some sort of help in the process, but it's when you feel comfortable enough and when you can get the right person. Because I'm a counselor, right? And I see a lot of people who have seen other counselors, and you're not compatible with every counselor that you
Oh
see.
God, no.
People are just not a good fit. Nothing against them, but it's just not a good fit for you. So you find someone that's compatible for you, and you sit down and you see if this is the one that God wants to use to help you in your process. But you got to really be led by God and directing you to who you need to see. And I think we always need assistance. I think we always should be open for it. Never try not to isolate yourself so much and not get the help you need. So I would say, if I would answer that question, I would say, immediately is the point where you want to get some help for that healing process. And don't feel like you're being overbearing, because sometimes people feel like, well, you don't want to hear about my problems, and you don't want to hear my story. I want to bore you.
Yes, I do. Yeah,
And
yeah, I do. Yeah, yes, I do. I want to hear it. You know
you'll
why? Because
talk.
just talking about it is healing.
Right, exactly.
Just getting it off your chest is healing. Tatiana, thank you so much for supporting Dad today. I love daughters that love their dads. It's
Right.
awesome.
She's a,
So that's great.
yeah, she has a associate's degree now in human services. She's working on a bachelor's.
Oh, she dangerous now.
Yeah.
You go, girl. Get your doctorate. Go ahead.
Right.
Hurt yourself. Get it. Get it. Get it. So we've got a few minutes, and I want people to hear how you don't get beyond the devastation. But how did you get to where you are, where you've now at the place you are mentally
Uh-huh.
and spiritually?
Right.
What now has transpired these last couple months that I want you to share with everybody?
Well, I thank God for my son that was just born recently 2 months ago, and God, it's like almost like restitution. I didn't expect that to happen, but I know God sees us, and when we go through devastation, I don't want anyone to ever feel like God has abandoned you because you're going through a devastation. God still is there with us, for us, and He loves us through it all. And that's why I want to encourage people that are watching to keep that in mind, that even in those moments of devastation, and we feel very alone when we're devastated. We feel very alone when we're going through trauma, but know that God is still there. So you just have to choose to recover. I want to recover. I want to be in recovery. And when you make that choice and you tell God, He will help you. He will send people your way. He will help you to find what you need. God is a great director, great guidance, and the Holy Ghost will direct you. And I tell people, God is a strategist. He will strategize and give you strategy so that you can get to the healing that you need. And it's not going to ever be over as a process. And you may always have those moments, but you learn how to deal with them better, and you're growing in your recovery. So that's been my testimony. I always encourage others to do the same thing, is to choose to recover and to make sure that you know that you're not alone. No, you are not alone. Don't let the enemy tell you that you've been abandoned.
Yeah, and listen, God. I love God because He has a heart, truly has a heart for His people. Now,
Amen.
He could have really been unfair to Robert to give him another girl, but God decided to break it up and said, no, wait a minute. We're gonna add a boy to this mix. So
Right.
God, but either way, whatever if it was a boy or a girl, God blessed this union to have another child.
Right. Right.
Because the devastation, like you said, it's an everyday that you're in recovery.
That's
Just
right.
you hear the Alcoholics Anonymous talk about every day, right? This is every day.
Mm-hmm.
It's a struggle to stay sober, to
That's
stay sane.
That's right.
Really, I think that to stay sane is really where it is. But
Right.
this story for me really encapsulates why I do what I do.
Amen.
Because I want the world to hear these stories that you can get beyond the devastation.
Right.
No, that child does not replace the other.
Right. Right.
It's not, God didn't give a replacement,
That's right.
but God gave another chance. God gave another opportunity for him to have a child,
Right.
them to have a child.
Right.
And because God saw the love that they had for all the children they have.
Man. Amen.
And God knew that this couple had the bandwidth to take on number 9.
Right. That's right.
Whoo, Jesus.
Right.
I mean, he got a church all by himself. If nobody shows up,
That's right. I do.
he got more kids than most people got in the church. Oh, I'm sorry. I should have said that too loud. But anyway, y'all get it. That's just just forgive me for who I am.
That's
but
right.
Robert, can you one more time just give that website for that New York?
Okay, absolutely. You could definitely go to NewYorkProjectHope.org. I think someone probably put it in the comments. New York Project, it's NY, I'm sorry, NYProjectHope.org. And if you want information about myself, because I also provide service.
Please give a plug. Yes.
My website is robertaferrer.com. You go to robertaferrer.com, or you go to nyprojecthope.org. And on newyorkprojecthope.org, there's so much information on there that can benefit you. You get tons of information about coping skills, exercise, eating right, emotional health, mental health. It's a plethora of things on that site that you can take advantage of, and also get information about calling in if you need to make a crisis call. You might have a moment. Sometimes people have a moment. You just need to talk to somebody. You can call somebody and talk to somebody completely anonymous, completely free, and completely confidential. They don't even write your name down or anything. So if you want to talk to somebody, you can definitely go there, and you definitely will get what you need. It's a great service.
And I love your administrative assistants that you have, because they're helping me out today and putting everything in the chat. So I think it's your wife and your daughter that are listen. Lady Ferrer, thank you. Tatiana, thank you. I want to look forward to seeing one day when you do have that doctorate robe on.
Right.
I'm gonna speak it into existence. How's that? And just call it what it is.
That's
Go
right.
get them. The world needs more doctors of color, especially
right.
in this field.
That's right.
To deal with the trauma and the human services that that are out there.
That's right.
So it's hard to close, but we've tried to stay at 30 minutes as much as I can. Mm-hmm. But Robert, parting words to you is, well, be honest. Mm-hmm. What are next steps if they're dealing with something right now? What can they do today? I know you said call New York Project Hope, but what can they do? Because some people are sitting home right now listening to this saying, I'm depressed. Mm-hmm. I just happened to find this, this podcast. I happen to stumble on it. Mm-hmm. If they're listening to it right now, mm-hmm. what's the best? What can they do?
I encourage anyone that is watching, and you may be in the middle of a crisis, emotional, mental crisis, make the call, reach out, talk to somebody. Don't sit there and allow your mind to get the best of you and bring you down and destroy you. But you got to be intentional. That's our biggest. That's my biggest mantra. I push it. Be intentional. Don't just sit back and allow yourself to be destroyed. You go ahead, make the call, Google, look out for somebody, go to Psychology Today, find someone to talk to, but do what you have to do for you, because God has you here for a purpose and a plan, and you have an assignment on your life. If you didn't, you wouldn't be alive right now. So don't let it get overwhelming and destroy you, but make the call, be intentional. And I'm praying for you that God will help you to do that.
And when he said that, I remember, I just, because you might be dealing with suicide. Mm-hmm. And unfortunately, we're seeing the rise in clergy.
Right.
But I heard T.D. Jakes say this one time. He said, don't allow the devil to steal your future.
That's right. That's right.
That was like impactful to me. So I really appreciate that. Look, next week we will have Dr. Barnes. She's an African-American young lady who's got her doctorate in psychology. She worked for the New York City school system. Now she's in her own practice. She's going to come and talk to us about Beyond the Devastation, how she dealt with the COVID issue within the school. Wow. And I just thank God my wife retired from being a principal at the right time. But Robert, I'm going to play my theme song on the way out.
All right.
So let's play that little funk.
Thank you again.
Oh, thank you. Here we go.